Hi, everyone. This is Charlie with the First 5 Years Fund. Thank you all for joining us. I'd like to introduce the Executive Director of the First 5 Years Fund, which is the organization that powers the Invest in Us campaign, Chris Perry. So I'm going to hand things over to Chris.
Thanks, Charlie. Good morning, and thank you all for joining us. My name is Chris Perry, and I serve as Executive Director of First 5 Years Fund, and we have the privilege of helping run the Invest in Us campaign in partnership with the Obama administration. This is the third webinar that Invest in Us has hosted over the last few months, and we're glad to have you with us. Today, you're going to hear from a number of individuals on the importance of social and emotional development in early learning settings. Findings from a 20-year study published in the American Journal of Public Health say a simple assessment of a child's social competence can predict health and social outcomes well into adulthood. I'd like to thank one of our presenters, Carrie Ann McGarry with the Robert Wood Johnson Foundation, an incredible organization working to build a culture of health across the country. We're grateful for RWJF's continued support in the Invest in Us campaign. And before we begin, we're privileged to be joined today by three tremendous advocates working within the Obama administration on behalf of children and their families. First up, we have Kyle Lehrman, Associate Director of Public Engagement at the White House.
Thanks so much, Chris. And hey, everybody. This is Kyle Lehrman. I'm a Senior Policy Advisor at Domestic Policy Council and an Associate Director in the White House Office of Public Engagement. So I get to work for two incredible advocates for early childhood education, Cecilia Munoz and Valerie Jarrett. And really, I'm here today just to say thank you to everyone on the phone. The President continues to prioritize early childhood education in every way that he can. We were at a great event with Valerie and Secretary John King yesterday at Powell Elementary School here in Washington, D.C. with the Invest in Us campaign. And it's amazing to think that actually the Invest in Us campaign just launched a little over a year ago. We've seen so much incredible momentum throughout the country pushing for increased investments from both the private and the public sectors across the country into early childhood education. But when you're winning, that's when it's time to double down. And we know that the folks on the phone are really the ones who, you guys are the ones who are doing the work in the communities, making these benefits possible for so many of our youngest kids and infants and toddlers. And we are going to do and continue to do everything we can to support the incredible work of the folks on the phone, of folks like the Robert Wood Johnson Foundation, of the Invest in Us campaign from the White House and from across the administration. But we can't do it without all of you. And so huge thanks for everything that you're going to do. 2016, I think, is going to be the best year yet for early childhood education in this country. And we're excited to keep moving forward on this push with all of you. So Chris, thanks so much for the opportunity. Linda and others on the phone, and Robert Wood Johnson, thanks so much for your efforts, and we appreciate everything and all you do.
Thanks, Kyle. Now we'll hear from Linda K. Smith, Deputy Assistant Secretary and Interdepartmental Liaison for Early Childhood Development with the Department of Health and Human Services. Linda?
Well, thank you, Chris, and I want to welcome everyone to the call as well, and happy holidays to everyone, and just say what a great day for early education yesterday was. As we got our final budget for this year, and we had an over $900 million increase in our early education programs here at HHS between Head Start, Early Head Start Child Care Partnerships, and Child Care. We came very close to getting to the $1 billion increase, which was phenomenal. And I feel before we get started that we need to thank everyone on this call for all of the advocacy and support that they've provided to this effort over the last several years. I really do want to spend just a few minutes talking about how important the topic is today, and especially it's very important for us here at the Department of Health and Human Services. Social, emotional, and behavioral health is a topic that we've been focused on here for quite some time. We all know that from the very first days of a child's life, they begin learning through social interactions with their mother and their father and others in their lives, and that what they learn in those very first years and days of their life in terms of how they're responded to sets a tone for their development and how they view the world later on. So it's an extremely important topic to us. We know that children who have secure attached relationships with trusting adults are more advanced in their cognitive and language development and show greater achievement in school later on. So these things are not to be, put on the sideline. They're to really, we need to be taking social emotional development and health as the first step to really good school readiness. There have been a number of studies, and it shouldn't be a surprise to anyone on this phone call or on this webinar, that that over the last few years we have studied this issue more, and we are really finding incredible outcomes associated with children's social emotional competence. In fact, for every point increase in kindergartner social competence, children were 54% more likely to earn a high school diploma, twice as likely to attain a college degree, and 46% more likely to have a full-time job at the age of 25. And there's equally negative decreases in certain factors when their points go down. So these things are really important, and they do have an impact later on in life. One of the key pieces of this, and we all know this, is that the key to so much of this is support for our teachers, for our trainers and coaches, and for the wellness of our own teaching staff. We need to do a better job of supporting them and getting them to understand child development and the social emotional issues that surround some of these earliest years. To that end, we at the Department of Health and Human Services have, with our partners, at SAMHSA and HRSA, just launched a National Center on Excellence in Early Childhood Mental Health Consultation. And we're very excited about how we can begin to help states and others around the country in using evidence-based coaching and interventions to help reduce expulsion and suspension and promote healthy social emotional development. So we've got a lot of work still to do, but I just wanted to set the stage that how important we view the social emotional development of children and how critical it is to everything else that we're doing today. So again, Chris, thank you for hosting this webinar, and especially on this just absolutely important topic. And again, thanks to everyone for joining, and happy holidays, everyone.
Thanks, Linda. So at the end of the webinar, we're going to hear from Libby Doggett, who's the Deputy Assistant Secretary for Policy and Early Learning at the Department of Education. So that brings us to the main event. And now it's my pleasure to hand it over to Carrie Ann McGarry with the Robert Wood Johnson Foundation, who's going to get things started. So Carrie Ann?
Thanks, Chris. You know, it's my absolute pleasure to be here, and I thank the First 5 Years Fund and the Invest in Us campaign for having us on today and for focusing on such an important topic and something that Linda has spoken to so eloquently. And as Charlie and Chris have mentioned, I'm Carrie Ann McGarry. I'm here today representing the Robert Wood Johnson Foundation. Next slide, please. At the Robert Wood Johnson Foundation, we are striving to create a culture of health. This means we want to see an America where everyone has the opportunity to make healthy choices and live a healthy life. Children and families have always been a critical part of this effort. We've approached this in a number of ways, by helping children grow up with a healthy weight, or by promoting access to health care. I work in the Research, Evaluation, and Learning Unit at the Foundation, and I work hand in hand with the Strengthening Vulnerable Children and Families portfolio. And through this work, we are focusing on young children and their families and hoping to develop their social, emotional building blocks of lifelong health. Next slide, please. I don't have to remind this particular crowd of the mounting evidence that early skills matter. We know that early academic skills can predict college and career success, and that early behavior problems can predict crime outcomes. There has been growing evidence that social and emotional development matters, but we weren't sure how much or for how long. Next slide, please. To be clear, when we talk about social competence or social skills, we are talking about a child's ability to manage his or her feelings, maintain positive relationships, and achieve and set goals. Next slide, please. This summer, we released the findings from a 20-year study that suggests that kindergarten students who are more inclined to exhibit social competence traits may be more likely to attain higher education and well-paying jobs. These are things that Linda's already mentioned. I'll just talk a little bit more about the study. Researchers from Duke and Penn State University tracked what happened to nearly 800 kindergarten students from 4 different locations after those students were evaluated on their social competence skills by their teachers at the age of 5. Next slide, please. Teachers were asked to rate their students based on 8 questions. You'll see them on the slide. These questions are focused on specific social skills, like whether or not a child was good at sharing, cooperating, or being helpful to others. Next slide, please. 2 decades later, researchers looked at a bunch of administrative data. They took official records, reports from parents, and self-reporting from the participants. The study found that kindergarten students with greater social and emotional skills were more likely to obtain a higher education and hold full-time jobs. Students who lacked these skills were more likely to drop out of high school, abuse drugs and alcohol, and spend time in jail. In fact, these results also showed the greater the difference between students' social competence scores in kindergarten, the more pronounced the difference in their outcomes by the age of 25. Children who scored at the higher end of the spectrum for social competence, for example, were 4 times more likely to obtain a college degree than children who scored at the lower end of the spectrum. Let me just say that again because it's quite compelling. Children who scored at the higher end were 4 times more likely to obtain a college degree than children who scored at the lower end. Let's go to the next slide. We can start going through some of the statistics. To break down these numbers even more, the study found that for every 1 point increase in a child's social competence score in kindergarten, he or she was twice as likely to attain a college degree in early adulthood. Sorry, that's that slide. 54% more likely to earn a high school diploma, and 46% more likely to have a full-time job at the age of 25. In addition, for every 1 point decrease in a child's social competence score in kindergarten, he or she had a 64% higher chance of having spent time in juvenile detention. Next slide. 67% higher chance of having been arrested in early adulthood. Next slide. 52% higher rate of binge drinking. And finally, 82% higher chance of being in or on a wait list for public housing. Next slide. These are numbers we can't ignore. We learned that social competence more consistently predicted all outcomes when compared to other factors like race, income, gender. Next slide, please. I know I've thrown a lot of statistics at you, but I hope you can stay with me and keep a few things in mind. Next slide. This study doesn't independently prove causality on its own, but when combined with other research, it suggests there's something real, measurable, and potentially it can be supported to understand more about what's going on and where the causality lies. This study is a foundational piece of that evidence base. Many of us are working in this space, and we can use this evidence to bolster the important case for change. It's compelling proof that helping young children develop social and emotional skills is one of the most important things we can do to prepare them for a healthy, successful future. Next slide. The very good news in all of this is that social and emotional skills can be learned. There are proven tools to help parents and teachers improve a child's social and emotional skills before and even after kindergarten. These numbers don't just highlight that developing our children's social and emotional skills is the right thing to do. They suggest that there would be a significant return on investment for those social skills. If our nation were to provide every family and school with the tools they need to foster healthy social and emotional development, the returns on that investment would more than cover the cost. If the U.S. were to reduce the annual number of high school dropouts by 700,000, it would generate $90 billion in tax revenue each year, because those high school graduates would be significantly more employable. In just 11 years, that adds up to nearly $1 trillion in revenue. By staying in school, young people grow up to live healthier lives that also incur fewer health care costs. Findings show a high school graduate is 50% less likely to use Medicaid than a dropout. There's a lot of enthusiasm for supporting investments in our youngest learners, but it's not clear which investments would make the biggest difference. At the Robert Wood Johnson Foundation, it is our hope that this study can be a key piece of that puzzle, substantiating and elevating the case for social and emotional development. We know that where you grow up and how you are raised has a profound impact on a person's lifelong health. As a foundation primarily in the health space, we are motivated by this research because it demonstrates so clearly that helping young children develop social and emotional skills can prepare them for a healthy future, no matter where they live, no matter what their zip code is. Currently, we are excited to be working with organizations that are prioritizing the social and emotional well-being of our children. For example, we are working with the New Teacher Center to develop a curriculum to support teachers to feel equipped to support their students in their social emotional development. We're also working with the Collaborative for Academic, Social, and Emotional Learning, or CASEL, to determine who benefits the most from social emotional learning in which school districts, and how to continue promoting successful strategies within each community. Early next year, we will be working with the Aspen Institute to launch the National Commission on Social, Emotional, and Academic Development. The Commission will be charged with bringing together all the different players in the field, all of whom can call this work by a different name: grit, mindfulness, pro-social skills, etc. The Commission will serve as a national voice to advance the best in research and practice and make social emotional learning a priority at the national, state, and local levels. We are devoted to this issue, and although it's never too late to develop social skills, we recognize the immense gains we can make if we intervene during a child's youngest and most formative years. Next slide, please. While social and emotional learning has become more relevant to policymakers and advocates, it's difficult to quantify these skills. This spring, the authors of the social competence research, Mark Greenberg, Damon Jones, and Max Crowley, will release a new paper that makes the case for thorough economic assessments on the importance and effectiveness of social and emotional development. And in my role at the Foundation, I'm listening for where research gaps exist. And I'm delighted to present this new research to this burgeoning field and hope that this paper will serve to continue to move the needle forward on this very important issue. And I hope you'll stay tuned. Next slide, please. For additional resources on this research, please feel free to check out the Fast Track project online And for more policy information and updates, check out the Collaborative for Academic, Social, and Emotional Learning, or CASEL. And I thank you so very much for your time today.
Thank you so much, Carrie Ann. That was really, really great, and we will certainly make those resources available in the follow-up communication we put out to our participants today. And now we're going to hear from Andrew Lister, who is a Childhood Development and Education Supervisor for Head Start of Fayette County, Pennsylvania. And Andrew is going to provide an overview of the challenges and opportunities he and his team face implementing social and emotional learning curricula for in a Head Start setting. So Andrew, feel free to take it away.
Okay, hey, thanks a lot. I appreciate that, and thank you for the opportunity. I want to tell everybody good morning. First of all, I want to wish everyone a Merry Christmas and have a great New Year. Like you said, my name is Andrew Lister, and I'm an Education Supervisor with Head Start of Fayette County in Pennsylvania. And today I want to talk to you about a great curriculum that we have implemented in our program that deals with the social, emotional growth of our children. First of all, I want to talk a little bit about negative cycles. We have many negative cycles that need to be broken, and sometimes it takes several generations to break a cycle that took one generation to create. And we have to learn how to break that cycle of negative reinforcement and unnecessary punishment. And Head Start teachers have the potential to transform how the neediest children develop their social and emotional skills. Our teachers here at Head Start are in a great position to mold young minds, and they can mold attitudes and emotions. One of our keys is self-regulation, and we believe that is the key to a healthy and productive life, and we have the strategies to achieve that. Next slide, please. Let me tell you a little about where we're from. We're from Fayette County, which has a population of 135,000. We're about 40 miles south of Pittsburgh. 5% of those people are under 5 years of age, and our poverty levels are 14% of all families. 29% of those families are with children children under the age of 5. I want to talk a little bit about how we implemented our program. Through Head Start Cares, we piloted 3 social and emotionally developed curriculums. And the Incredible Years curriculum was chosen based on staff and management input. In 2010, we were awarded the Center of Excellence grant for 5 years under our Social Emotional Early Development Success Program, and that's what we call the SEEDS program. Our vision is to have a community supportive of the health and social emotional development of all children. This curriculum was based on research from the University of Washington, whose primary purpose was to design effective treatment programs to help families. For over 25 years, they collaborated with, studied, and conducted parenting programs with over 3,000 parents with children ages 3 to 8 with behavior problems. This was a great fit for our program because it was based on positive discipline that our program is also based on. It has specific strategies that our program also has. It had a parent curriculum, and it can be used with any student, and it teaches self-regulating. We have staff trainings that implement the program. We have parent trainings, and we have community trainings that all implement the Incredible Years curriculum. We train staff to implement it in lesson plans and goals, specifically identifying positive behaviors, academic coaching, and persistent coaching. They use incentives, and they use child-directed play. Next slide, please. Okay, we train parents at evening workshops throughout the county, and we train other agencies, schools, and any group that we can pass this information on to. In fact, our parents are so grateful for our program, and you can see some of the quotes that our parents have said about the program. Now, our grant ended in 2015, but the Private Industry Council and Head Start will continue the program through our education department. Other community organizations are turning to Fayette County for research. We like to think of ourselves as a lighthouse to change. We send out a light into dark places to break that negative cycle and steer families to our shores where a more positive, productive light awaits them. Some of our successes. Some of our successes are we have a lot more parent involvement. Parents feel connected to this program, The Incredible Years, that gives them confidence in raising a family. It gives more confidence to our staff, which gives them a clear direction to go with instructing families, and they feel more secure with planned instructions and support. Leading the way for other Head Starts to follow is also one of our successes. We're breaking new ground, and we love to spread the news and bring other agencies into the fold. Some of our challenges. Training new staff is always a concern. Also, budgeting is a big concern to us. But with new staff, we do have a high turnover, and we look at it this way. Staff that leave us are taking this information with them to other agencies, businesses, or families, and we consider it still spreading the word. Lessons learned. It takes a lot of work to break new ground, but we've done it, and we're ready, and we're prepared to keep moving forward. We've learned, and this is an old saying from way back, you can please some of the people all of the time. You can please all of the people some of the time, but you can't please all of the people all of the time. Our education department will continue with the Incredible Years curriculum and staff. And we'll continue training parents also. These are our next steps. And we always go by the philosophy, a 1,000-mile journey begins with a single step. We feel we've traveled that first step, and we're excited to continue the journey. Even though the grant has ended, we see a real need for this curriculum in our community. So we're going to carry on the training with our families and staff. And someday we're going to break that cycle, and hopefully it's going to be with this generation. And I thank you all for your attention.
Thank you so much, Andrew. That was very helpful, and it's great to hear about the great work you're doing in Pennsylvania. We're now going to turn it over to questions from some of our participants. On your screen within GoToWebinar, you have the ability to raise your hand and ask a question. You can also submit a question in text form on your screen. So if you'd like to ask a question, please go ahead and click that raise your hand on the screen, and we will be able to make your mic live. It looks like we have one hand up now, and we'll hear from
Hi, this is
Julianne.
Yes, this is Julianne Nickerson in Vermont. And so the question I have when I was hearing about the Incredible Years and the great work, but the talk about the positive discipline, I'm also really familiar with Carol Dweck's work about how we do a lot of overpraising in our culture in our society, and I'm just wondering if that's included and if you're familiar with that research and what the balance is in the Incredible Years.
And that's questions for me, I'm assuming. Hello there, Vermont.
Yeah.
How are you?
Hi, good.
All right. And your question has to do with, would you say over-reinforcing?
Yes, so Carol Dweck has a lot of research that she's done looking at kids and how there's so much praise, the external praise versus internal praise, and how we support kids to recognize the good work that they do internally versus all the external comments of people saying, oh, you did really well, oh, that's really good, and oh, you're super smart, and how the impact of that on kids has shifted how they perceive themselves. So it's an interesting sort of look at how we're doing the praise of kids. And so when you were talking about the positive discipline work within the Incredible Years, I was just curious if you're familiar with the Carol Dweck work, and if people are thinking about that as well in that curriculum.
Well, I'll tell you what we're always interested in is when you give your praise and reinforcement, we always want it to eventually be where you don't have to, where it is all internalized. So when we're working with the very young children, we do have to give a lot of praise, a lot of positive reinforcement. And the Incredible Years is based on the positive reinforcement that really clicked with our program. But we do want to make that as a child grows up, of course, they leave Head Start, they go into regular school. We want to make that so when they become productive adults, they don't need that constant reinforcement, that they get reinforcement from inside. So the ultimate goal would be for the child to be reinforced in themselves eventually, and also for the parents to understand that. And that's a big part of the Incredible Years, is for the parents to also understand that. I hope that's kind of answered your question, but that's what the ultimate goal is for children. I know when I don't teach school now, I'm a supervisor, but when I taught school, that was my ultimate goal for the child when they left me, to feel good about themselves when they did a project or they had something done. When they feel good, then that makes the teachers feel good, because we know we've done our part. They should want to do it on their own, and that when they go and then become adults, they're not going to get that reinforcement as even older children or adults. So they have to learn where that's going to come from. That's going to come from inside. So I hope that answered your question. We do start out with a lot of praising and reinforcement, and it gradually goes down as the child gets older to where they don't need that.
Thank you so much. Next, we have a question from Mary Lynn White.
Hi, thank you all so much for putting this together. I'm wondering about the National Commission that's going to be formed and how we can get more information about that and possibly get involved in that at that level.
I think that's
a question for Carrie Ann.
Yeah, I was just going to say, I think that's for Carrie Ann. So the commission will be launched in early next year. I don't have a definitive date, but it is going to be something that the Robert Wood Johnson is funding with the Aspen Institute as our partner. So you should look to the Aspen Institute to find out more about when that will launch, but they should have coming events and other communications out from Aspen on that. If you have anything else you want to add or ask about that, you can email either Charlie or Chris, and they can get that question to me, and I can get you more details.
Okay, thank you so much.
Oh, you're welcome.
All right, so I think we'll take one question that was submitted online, and the question is for Andrew. What was the initial grant that their organization received for the program?
Do you mean the amount of money? Or
yeah, I believe so. Yeah.
You know what? I have to be honest with you. That I do not know the exact amount of money on that. I know we got that grant through the Center of Excellence, and we were one of 10 in the country that received that grant. I do also know that we were of those 10, we were the only one that used that money, of which I'll be honest with you, I don't know how much it is, but we were the only one to use that money to implement a curriculum, of which we chose the Incredible Years. So that would have to, my answer would have to be I don't know the exact amount of money, but I do know that it was a federal program that came out of the Center of Excellence, which now has ended. It was a 5-year grant.
Thanks. We're going to take one last question over the phone, and that's going to be from Stephen Irwin.
Yes, I was just wondering what assessment tools were used to support the research-based strategies to improve social-emotional growth?
Do you mean on our part or the company that puts out the Incredible Years?
Anyone who's been doing some of these strategies, and how do you assess that, and how do you know that you're raising that bar?
Okay, well, thanks a lot, Stephen. How are you doing?
Doing fine.
Okay, that's good. And that's a good question, because when we implemented the Incredible Years, that was one of our concerns was how do we know that we're getting into something that has been research-based. And then we did look at all the research that they did. And I mentioned this earlier, that they did it out of Washington. And their main company, I believe, is out of Seattle. So they did have a lot of research to back everything up. There were some companies that we looked at that did not have as much research, but the Incredible Years did. So through all the research they did, it was a good fit for us, and we used what they have, and they had a lot of information and a lot of research to back them for us. Now, what we did when we implemented the program, we thought the same thing. We thought, how are we going to measure it, and what are we going to do, and is this going to be a good fit for us? So what we did was, when we looked at several curriculums that are socially emotionally based, we looked at ones that had specific strategies that we had. They had specific goals in mind. It was all dealing with self-regulation. It was all positive based. So what we did was, when we picked that, we piloted that through a classroom. So we took a teacher, sent him to training. We had him come back, and we piloted the program in that one room. Then we looked at the results, because we thought, well, if he pilots that and it's not a good fit, or if it doesn't look good, we're not going to use it. He loved the program. It worked great. We had some of our management go in and observe that. He worked on strategies that were in the Incredible Years. The children's behaviors dropped, bad behaviors, I should say. Good behaviors went up, and he used the strategies mentioned. So from our observations, from tools that the Incredible Years sent, such as different various checklists and things of that nature, we saw that it was a great fit for us. Only then, after the pilot program and then discussions with management and staff, did we go with the Incredible Years.
Great. Thanks so much. And then that sounds great. Our final question for Carrie Ann, somebody's asking, does your research show that this should be started with infants or toddlers, or at the preschool age level?
Thanks so much for that really insightful question. I think from the research using the fast track data, what that did was assess a child's ability to share and other markers that were measures of social, emotional learning and competence. So of those children, there was no analysis done to see if of those children who scored higher on the competence scale also were involved in high-quality preschool programs. But what we do know is the earlier you start, the higher the gains. So we do know that the earliest years matter, and we do know, not just from the research that I presented today, but from all the research that we have seen, that the earliest years matter, and you have the largest return on investment the earlier you start.
Thank you very much. That is all of the time I think we're going to have for questions, but I really appreciate all of the really great questions that came in. For those of you whose question we didn't have a chance to answer, please feel free to submit those through the email address that was on the webinar invitation you received. You can also send them to info@ffyf.org. That's info@ffyf, or first5yearsfund.org. And it is now my pleasure to turn it over to Libby Doggett, who is Deputy Assistant Secretary for Policy and Early Learning at the Department of Education. Thanks so much, Libby.
Thank you so much, Charlie, and thanks to Andrew and Carrie for a wonderful presentation and all the work that the Robert Wood Johnson has done for decades on just amazing things, and I'm so delighted that you're looking at this area. First, I want to assure everybody who's on this wonderful webinar that we at the Department of Education are as concerned about social emotional learning as everybody in the country, and we have a focus in this area. In early learning, we call it more social emotional learning. As we get up into the higher grades, we're really focusing a lot on the climate in schools and what can we do in terms of helping teachers and teacher leaders, principals, superintendents and others really create the kind of climate, which of course includes social emotional learning, that kids need. I think, you know, from this I really learned how complex this issue is. We have to work with parents because they are indeed our children's first teachers, and every parent wants what's very best for their kids. They just may not have the skills or support or the wherewithal to do what's best, and with great programs like Incredible Years and some of the wonderful home visiting programs we have out there, their parents are doing a lot better. I know every parent wants more support and wants to do a better job. I think it's really important that we've got to work with teachers. We're going to be very much focused on teachers this year and salaries and compensation because you've got to support your teachers. I think the teachers in early childhood are even more important than those in K-12 because it's the teacher in early childhood who sets up the environment, and that interaction with that teacher and the relationship that's built is so very important. In later years, peer relationships become so much more important, but in those early years, it really is incumbent upon the teachers, and we've got to do a better job of supporting our teachers, providing them with the compensation, the skills, the background, the education that they need to do a good job. And then I don't want to ever forget about instruction. I think we're talking about social emotional because there's been too much of a focus on instruction, but they go hand in hand, and really great instruction. And I don't mean sitting down with paper and pencil. I mean really setting up a classroom where children are engaged in hands-on learning, and not just in preschool, you know, but first and second in grades as well. Will go a whole long way to improving the social emotional development of children. And then finally, I just want to go back to the parents and the teachers and remind us all that we serve as an example for children. I'm reminded of a story that we tell in our family where my oldest daughter, who's now a family physician, but was visiting my parents, and she picked up her cereal bowl and drank the rest of her milk. And my mother said, "Lisa, that's not the way to eat your cereal." And she said, "Oh, but this is the way my daddy does it." And so, you know, we have our children in our classrooms and at home, and now as a grandparent, our children are watching us. And if we're treating each other with respect and showing discipline and doing all the things that we want them to do, they will learn a lot of that by osmosis. So we need to do a better job teaching it. We also need to do a better job doing it ourselves. So thank you all for what you're doing, and Len, thank you for letting me wrap it all up.
Absolutely. Thank you, Libby, and thanks to as well Linda and Kyle and Chris and obviously Carrie Ann and Andrew for making this webinar happen. It's clear from what we heard today that the first 5 years last forever, and the social and emotional experiences and skills that a child has in those first 5 years stay with them for the rest of their lives. So this is important, and we are grateful to have heard from folks who are doing great work and making a difference in community and helping to influence other communities across the country. This webinar will be available online later today, and we will be sharing it in an email to all of our attendees. And like I mentioned before, if you do have questions or would like to ask something of one of our presenters today, please send us an email, and we would be glad to put you in touch with them. And so now we're going to sign off, but thank you to everyone who joined us today, and we're looking forward to another webinar very soon. Thanks so much. Bye-bye.